Hi, everyone. So we just have a few rapid fire questions for anyone on the panel to answer. So our first question is, what would you like to see change in the field of vascular surgery?
So I think the most important thing that we've touched on a lot of things a few times. I think a couple of really big things that we haven't touched on is how quickly vascular is emerging in the center of the conversation around health equity. And it's really remarkable how we've touched a little bit on diabetes associated foot care and access to care, but more and more you see that being a huge part of what we're about. I think we have work to do to emerge as leaders in that space, that vascular care is health equity in this country. And it is improved if we are more diverse in our workforce, if we embrace our role in the direct care of patients who don't have anywhere else to go. I think that is the thing I would like to see us continue to push forward in.
So I guess I'll go ahead. Thank you so much, Dr. Nelson. And I would ask the last question that we have for the rapid fire. And that is, what is the toughest aspect of your job? Dr. Nelson, if you can just pitch in for us with this one.
So the toughest aspect of my job, in some of my recent roles, I've taken a lot more administrative responsibilities, and I did that intentionally. I love it. I love being someone who it's not so much about me anymore. It's about my junior partners and recruitment and fellows and residents and students. But there are times where I feel like, I love the surgical aspects of being in the operating room of what we do. And sometimes I sit in administrative meetings and I think, gosh, I wish I was doing an aneurysm right now. The good news is I'm actually driving home from work right now. I did an upper extremity axillary brachial bypass on a young lady with very complicated problems. So that's not something we do every day. And then I'm going to go home, have dinner with my family, let my dogs out, and then turn around and do a fenestrated EVAR tomorrow morning. And, it's the spectrum of what we do, the complexity, but the excitement of what we do is just amazing. And so I'm tolerating the administrative things because I think it's important. We do need to advocate for ourselves, either with the hospital or with our, university administration. And so I'm happy to do those things. But, being in the operating room, I think is where we all really enjoy our time the most.